You're still watching One News Now. I'm Riza Diaz. A ring remains to be a threat as it approaches the landmass. To give us the latest on this, we have with us on the line Pagada weather forecaster Meno Mendoza. Sir, good evening.
Yes, magandang gabi. Para sa ating update, ang ating bagyong si Auring sa kasalukuyan nasa layong 355 kilometers silangan ng Surigao City. May taglay na lakas hangin pa rin umabot sa 65 kilometers per hour at may makapagbugso na umabot sa 80 kilometers per hour. Patuloy itong kumikilos sa direksyong northwestward sa bilis naman na 20 kilometro kada oras. Ang ating signal number 2, nakataas pa rin to dito sa Kabisayaan, dito nga sa central and southern portion ng Eastern Samar, sa central and southern portion ng Samar, sa eastern portion ng Leyte, sa eastern portion ng southern Leyte, at sa Mindanao naman, nakataas ang ating signal number 2 dito sa Dinagat Island, at sa Surigao del Norte kasama ang Siargao at Bucas Grande Island. Samantala, ang ating signal number 1 naman, nakataas dito sa bahagi ng Mindanao, sa Surigao del Sur, Agusan del Norte, Agusan del Sur, Davao Oriental, Davao de Oro, Davao del Norte, Camiguin at Misamis Oriental at Bukidnon. Ang ating signal number 1 pa rin nakataas sa bahagi ng Visayas dito sa Northern Samar, sa nalaming bahagi ng Eastern Samar, sa rest of Samar, sa Biliran, sa nalaming bahagi ng Leyte, sa nalaming bahagi ng Southern Leyte, Cebu, Bohol, Siquijor, Negros Oriental at sa northern and central portion ng Negros Occidental, gayon na rin sa northern and central portion ng Iloilo at sa Capiz, Guimaras, eastern portion ng Aklan. Sa Luzon, nakatas na natin signal number 1 sa bahagi ng Sorsogon, Masbate kasama ang Tikaw at Burias Island, sa Albay, Catanduanes at sa eastern portion ng Camarines Sur, gayon na rin sa eastern portion ng Romblon. At para naman sa ating pag-ulan, ngayong araw hanggang bukas ng umaga, mararanasan pa rin ang moderate to heavy rains over Caraga, Eastern Visayas, Misamis Oriental, Bukidnon, Camiguin, Catanduanes, Albay, and Sorsogon, while light to moderate with times heavy rains naman over Zamboanga Peninsula, Mimaropa, Davao Oriental, Davao de Oro, Quezon, and the rest of Bicol region, Visayas, and northern Mindanao. So, in the next 24 hours, with the strong winds, combined effects po ng surge ng northeast monsoon at ng ating bagyo si Auring, magdadala ito ng malalakas na hangin dito nga po sa lugar kung saan nakataas ang ating tropical cyclone with signal number 2 at gayon na rin dito sa signal number 1. At sa Calabarzon, Mimaropa, Aurora at nalaming bahagi ng Kabisayan at Bicol region dahil naman po nga sa malakas nating hanging amihan. Ang ating tropical storm na si Auring ay inaasahang kikilos pa rin sa direksyong west-northwest to northwestward sa susunod na 48 oras. At inaasahan pa rin na posible pa rin itong maglandfall nga dito sa Dinagat Island, Eastern Samar at ngayon rin sa southern portion ng Homonhon, Leyte, mga bukas po ng umaga. At yan po ang latest mula sa Forecasting Center ng Pag-asa DST, Meno Mendoza nagulat.
Maraming salamat po Mr. Meno Mendoza ng Pag-asa Weather Forecasting Center. Meanwhile, more evacuation efforts are underway amid the threat of Tropical Storm Auring. In an earlier interview here on One News Now, NDRRMC spokesperson Mark Timbal reported that over 3,000 families or nearly 11,000 individuals across different regions have left their homes.
We have received reports from Region 7, Region 8, Region 10, and Caraga of a total of 3,162 families that had been preemptively evacuated in view of the arrival of Tropical Storm Auring. These 3,162 families can be translated to more or less 10,911 individuals that had been evacuated.
Timbal advised residents to coordinate with their respective LGUs and follow health protocols once evacuated.
If they have told you that evacuation is already being required, please make sure that you cooperate, bring your go bags, and please make sure that you wear your face mask, your face shield, and bring your sanitizers, and make sure that you observe proper physical distancing while evacuating and staying in evacuation centers.
The Health Department has identified 18 more cases of the B117 or UK variant in the country. This pushes the country's total B117 infections to 62. Of the new cases, 13 are returning overseas Filipinos, 3 are from the Cordillera Administrative Region, and 2 are still being verified. Meanwhile, the DOH reported more than 1,800 new infections today. That brings the country's caseload to above 561,000, over 26,000 of which are still considered active. Around 93% are asymptomatic or mild cases. The virus, meanwhile, killed 20 more patients in the past 24 hours, pushing the death toll to over 12,000. Some 522,000, meanwhile, have gotten better from the disease, with 9,700 new recoveries reported today. The Health Department's regional office in Central Visayas says it's still unclear where patients of mutations in the region possibly got infected with the virus. Earlier today, DOH reported that cases of these mutations of concern have climbed to 34 as 3 additional samples tested positive for both the N501Y and the E484K mutations. Speaking with us earlier, DOH 7's Chief Pathologist, Dr. Mary Jean Loreche, said what's clear for now is these are in circulation in the region. Though some of these mutations were also found in the South African and Brazilian variants, Loreche said there's not enough data yet to conclude if these strains are already in the country. Loreche also noted the possibility of these mutations forming a new kind of COVID variant.
We will wait for the Philippine Genomic Center to further sequence the samples and give us a feedback on what the name of this variant under observation or investigation right now will be in the future.
The regional office said they have advised LGUs in the region to strengthen their anti-COVID measures. Central Visayas has been under MGCQ since September, and Loreche believes it should stay that way. Now, as for the planned reopening of cinemas, Loreche has this to say.
As to the opening of the cinemas as part of the opening for the MGCQs, maybe that is something that we would be conferring with our leaders here in Central Visayas, whether they would want to push through with it or maybe just to delay it a little while.
Now, who are allowed to be inoculated against COVID-19, and why are some age groups not being vaccinated? These are just a few of the many questions the public has concerning the globe vaccination drive. World Health Organization chief scientists answer more of these. Let's watch this.
If I have already had COVID-19, do I still need to be vaccinated?
We know that most people who have COVID-19 do develop an immune response, but there is a subgroup of people, particularly those who have had very mild infection, and sometimes they don't even know it, it's asymptomatic. Those people we know have a less strong immune response compared to those who've been seriously ill and get good antibody response. So in general, we are now recommending that people should get a vaccine if they fall into that priority group, regardless of the fact whether they've had a previous infection or not. And the good thing is that, the immune system recognizes the same antigen, the same protein. So even if you've had a previous infection and you now get a vaccine, it acts like a booster and it boosts that immune response, both the antibody response as well as the T-cell response. And so you're much more assured that you have a good immune response and that it's going to last for a long time. Of course, how long this immunity is going to last is something that researchers are still looking at. We don't know the answer to that, but at this point we do recommend that you get a vaccine whether or not you've had a previous infection.
Soumya, another common question that we're getting is that the current batch of vaccines against COVID-19 is not for children under 16. What is the reason and the science behind that?
So whenever new drugs or vaccines are developed, they go through this clinical trial, right? The testing in people with the disease in order to make sure that they are both safe and effective. And this usually starts with adults because in case there is an unexpected side effect that we don't know about, we don't want children to be the first ones exposed. So all the vaccines that have been developed so far have been tested in people over the age of 18 years, or in one case, 16 years. And so that's the population for which there is data. That's the population for which these vaccines are being recommended. Because COVID-19 is a much more serious and deadly disease in the older people, all the developers have ensured that older people and people with underlying diseases like hypertension, diabetes, and heart disease have been included. So that group, we know that this vaccine works and it's safe, the ones that are getting approvals. The studies in children will be starting soon, and in the next coming months, we will get more data on children. Also, supplies are limited. Global supplies of vaccines are limited, are being targeted to those at highest risk initially. So by the time we get the data on children, there's more vaccines to go around. We will then make the guidelines for vaccination in children. But as of now, vaccines are for people above the age of 18 years.
Now, for more updates, visit News 5, The Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.